A third of all deaths linked to coronavirus in England and Wales are now happening in care homes, according to the latest figures. And that's against the context of the wider picture across the UK, because the total number of deaths during the week after Easter was much larger than initially reported and double what would be normally expected. In the week of the 17th of April across the UK, nearly 2,400 people in care homes died with coronavirus, twice as many as the week before. But the number of deaths in hospitals is going down overall. 586 deaths have been recorded in the past 24 hours. And that brings the total number of coronavirus deaths reported in this daily tally to 21,678. The daily figures mainly cover deaths in hospital. Now, the care sector says it is now the real front line in the battle against this pandemic. Our social affairs correspondent Alison Holt has more details.
At St Cecilia's nursing home in Scarborough, like many homes across the country, they believe the fight they have been waging against coronavirus for weeks is only now being reflected in official figures.
This is the area that we will have for anyone that's been barrier nursed.
They lock down early, have areas set aside for nursing coronavirus residents, and people stick to their rooms. But still, across the 3 homes in the group, they've had 11 deaths, 4 confirmed as COVID-19.
I was called and did see her for the last, on the day that she died. They asked
One of the residents who died was Reg Kemp's wife, Liz. They were married for more than 50 years and she loved spending time with her grandchildren. He says staff did all they could for her.
I just hope that the ministers do recognise the wonderful work that's gone on and goes on up and down the country in nursing homes, just like where Liz was. They're doing a job equal to anyone in the National Health Service.
The latest official figures from England and Wales, combined with numbers from Scotland, show that in the week ending April the 17th, there were nearly 8,000 deaths in care homes, an increase of almost 2,500 from the week before. Nearly a third of those were recorded as linked to COVID-19. The equivalent figures aren't available for Northern Ireland. Information collected by the care regulator up to last Friday suggests deaths in care homes are still rising. Even so, homes like this one continue to struggle to get the testing and protective equipment they need.
There are far more people being cared for outside the NHS than in the NHS, and they all need looking after. They deserve better than they've got. I think it's been too little, too late.
The government says mobile units and home kits are making testing easier and that all residents and staff will be eligible for checks. It insists it's also providing millions of pieces of protective equipment. But that offers no comfort here. Aisha is struggling to explain to her 2-year-old granddaughter why her mother, a care worker, isn't coming home. 26-year-old Sonia Kagan died of coronavirus. Her family say she loved her job looking after others, but they want people to understand the anguish and questions they are left with. They showed us the mask that Sonia had bought online to protect herself.
I believe what my sister has confirmed, that they have arrived when she was in hospital.
So too late for her.
Too late for her. But Sonia was one of the kind-hearted person. She cared for the others. She lost her life for the others.
In time, there will be questions that many families need answering about the impact of the virus on care homes. Alison Holt, BBC News.
The Scottish Government says it's decided to recommend that people should cover the mouth and nose when they're in enclosed public spaces such as supermarkets or on public transport. The First Minister, Nicola Sturgeon, said that people should continue to follow social distancing guidelines, but that using face covering would provide extra protection to other people. But scientists advising the UK government say that wearing a mask has only a small effect on stopping a coronavirus carrier from infecting someone else. Our Scotland editor, Sarah Smith, has the story.
Some do, some don't. Face coverings are becoming more common. Now you're advised, in fact expected, to wear one in Scotland in busy places. A move that may help protect others, but won't necessarily stop you from getting the virus.
Especially in the supermarkets, I don't like how close people kind of are, so yeah, I probably will have to start wearing one.
I don't feel particularly comfortable wearing it, but I would for the time I was in a situation where it would maybe protect me or somebody else.
Nicola Sturgeon sees the same scientific advice as the UK government. She's happy to reach her own conclusions and make different recommendations.
There may be some benefit in wearing a face covering if you leave the house and enter an enclosed space where you will come into contact with multiple people and safe social distancing is difficult.
Would you go so far as to say it's our duty to do that if we're in crowded spaces?
But I believe right now that all of us want to do everything we can to protect each other from this virus, and this is an additional way that we can do that.
On public transport or anywhere it's hard to keep your distance. The hope is that face covering could stop people who are infected but don't yet know it from spreading coronavirus. The advice from the Scottish Government is to wear a face covering, definitely not a medical mask. So you could just pull a scarf over your face, or you could make one yourself with any piece of fabric, some kitchen towels and a couple of elastic bands. It's not compulsory to wear a face covering in Scotland, but the government say it could become so. As home sewers get busy, the advice is to cover your face as well as staying at home and social distancing. Is it a concern that people wearing masks might think they're better protected than they really are and start taking risks?
There is no study that shows that happens, and it's a bit like arguing that if you wear a seatbelt you'll drive dangerously.
UK government advice says evidence on the benefits of face masks is weak. Westminster would prefer all the devolved nations followed the same script, but the Scottish Government are confidently moving in a different direction. Sarah Smith, BBC News, Glasgow.
The Health Secretary for England, Matt Hancock, says a mammoth effort is underway to get protective equipment to frontline workers. His remarks follow a BBC Panorama investigation which claimed that the UK government had ignored warnings from its own advisers about the availability of personal protection equipment. Our health editor Hugh Pym has more details.
Hospital staff treating the sickest coronavirus patients need appropriate personal protective equipment known as PPE, including gowns. But surveys of some doctors suggest a proportion of them still feel they can't always get the right kit.
I've been in a position where I know that where I'm coming towards the end of a shift, and I know that as things stand or stood at that moment in time, that the gowns that we had at that time would run out at some point during the next day. I've been lucky because my trust has managed.
Coronavirus swab.
Hospital managers say supply problems are easing, though it's still difficult to find gowns and visors. The government's been accused of not building up stocks early enough and allowing guidelines to be altered to protect supplies. The BBC's Panorama programme revealed that in January, COVID-19 was designated a high-consequence infectious disease. But in March this was changed and a lower level of PPE was required, with aprons rather than gowns for some staff. The government says this was based entirely on scientific consideration as to the nature of the infection. What assurances can you give frontline staff that there will be adequate supplies of PPE in the days and weeks ahead?
We've been moving heaven and earth to get the amount of PPE that we need to the front line, both buying it from abroad and also then distributing it. That system is getting stronger all of the time.
Dr Abdul Mabud Chowdhury died earlier this month, soon after urging the government to give NHS staff more PPE. Today, his son challenged the Health Secretary on a radio phone-in.
Do you regret not taking my dad's concerns seriously enough? My dad that we've all lost.
I'm really sorry about your dad's death. We took very, very seriously what your father said, and we've been working round the clock to ensure that there's enough protective equipment.
More PPE is arriving. This flight landed with a consignment today, with a very clear message to those who are going to use the equipment.